name is Brandy Butcher, and I am doing Activity 9, Role and Function for the SimPath BSN program for Sim 440. So with this activity, I will explain the role and function of case management in the acute care setting, home care setting, and primary care setting. I will detail the skills a nurse would need to prepare to do a community health plan for a patient, and I will discuss the details that case managers use to promote the highest quality of care with use of resources. Okay, so I'm going to start off by telling you what the definition of case management is. According to CCMC, it defines case management as a collaborative process that assesses plans, implements, coordinates, monitors, and evaluates the options and services required to meet the client's health and human service needs. So, I work in the ER, and it's a relatively new concept for us to have a case manager actually in the ER. They don't work all night, but we have them set up kind of staggered. So we have a few that work 7 to 7, and then we have a couple that work 11 to 11. And it's been life-changing for a lot of people, and it definitely helps from the nursing aspect. For us to be able to have that extra resource to help a patient. So in acute care or a hospital setting, it kind of depends on what department they work on. Like I said, the ER has them now, so they do a little bit different things than what they would do if they work on the floor. So ER case managers help facilitate outpatient follow-up appointments. They help set up DME supplies. And then I know sometimes patients have trouble getting certain medicines, so they will use whatever resources they have to try to either get the patient a discount or get them samples. And then sometimes it's as small as the patient has no way back home from the ER, so they'll help with transportation or to figure out someone to assist the patient to be able to get them back to where they need to go. If they work in the hospital, like up on the med-surg floors or the ICU, I think they are utilized more kind of like on a social work aspect. They educate the patient regarding disease process. They provide information regarding post hospital care services, and they make sure that they review the plan of care and make sure that it matches what the patient is needing. They also do utilization review to ensure that all the CMS measures are being met, and then they do discharge planning. So as soon as the patient gets admitted, I know that our case manager in the ER will make sure that the order is put in correctly, whether it's going to be an actual admission to an inpatient or it's going to be an admission for observation. So I know that they have an understanding of, how they are categorized is going to determine our reimbursements and if we meet the qualifications to put them in these settings. And then discharge planning. I know that we always discuss discharge planning, and they start it as soon as the patient is admitted. So even if the patient's going to be there for months, like discharge planning happens on admission. Home care services. So the case manager working in home care would basically, I did home health for a little bit. I did not do it as an RN, so I was an LPN. So I had a team. So the RN was the case manager, and then I was on the team. So the RN saw the patient once a week, but the LPN sometimes would go out twice a week or 3 times a week, depending on the needs of the patient. So as the RN, you provide basic nursing care, act as a liaison between the patient and the provider, educate patients and their family on a multitude of things, whether that be dressing changes or disease management, disease process, and just things like that. And assess and coordinate any additional needs such as DME equipment. If a patient needs a walker or oxygen or anything like that, they can help set that up. And then a primary care setting, they do screenings, wellness programs, community referrals, coordination of medical and social services, and make sure that the patient is knowledgeable and compliant with treatment. I think the skills that you would need to be a case manager would be great communication, because you're not only talking to the patients, their families, going back and forth between them and the physicians. So you just want to make sure that you have good communication skills and you're able to communicate between all of them and deliver adequate care. Autonomy, especially in the home care setting, because I know that you have a set amount of patients. Those are your patients, and you're responsible for doing and ensuring that everything gets done with them. So you would need time management and just to make sure that you're able to provide adequate care to them. Professionalism, because you're not only one-on-one with the patients, their families, but you're dealing with a multitude of healthcare providers to coordinate care. And then composure, because of course you're going to probably hear not only the physician getting upset or any of the healthcare providers getting upset, but you're going to be able to also hear the frustration and everything from the family side of that as well. So definitely just need empathy and be able to keep yourself composed and focus on the task at hand. And then I would say that you would need strong assessment skills, because you may not be providing all their care like the bedside nurse, but you sometimes, especially in the home, you're going to be the one that sees them all the time. You're going to be the one that are basically the physician's eyes and ears. So if the patient were to have a change, then you could be that person that spots that. And if you have strong assessment skills, then it would facilitate that a lot easier to keep an eye on the patient and make sure they're doing okay. And then as far as promoting the highest quality of care, I would say that case managers use evidence-based practice. They utilize multiple screening tools. They use clinical pathways that are tailored and specific to that patient. They're able to understand the financial aspect of it, and like the billing for Medicaid and Medicare and how that works. They have a long list of community resources, and if they don't, then they know who to get in touch with to figure out something to get help for these patients, and then provide quality teaching and education. Thank you.